An indwelling urinary catheter, commonly called a Foley catheter, is a thin, flexible drainage tube inserted into the body. It enters where you urinate and goes into the bladder. A small balloon is inflated at the tip of the catheter to keep the catheter in place. The catheter will continuously drain urine from your bladder, so you'll not need to use the toilet to pass urine. Following surgery, you may need a Foley catheter in place to help drain urine. When you're not able to adequately drain the urine in your bladder, it can increase pressure at the surgical site and cause complications. Infection rates also increase if you're unable to empty your bladder. In order to reduce your risk for complications and to help the site heal, some patients will require a Foley catheter to be inserted. Depending on the procedure you have, your Foley catheter may be in place up to 10 days after surgery. Later in this module, we'll discuss care of the Foley catheter at home. When you're discharged from the hospital, you'll be given 2 catheter bags. The first catheter bag is called a leg bag and is used during daytime hours. This allows you to be more mobile and discreet. It easily fits under loose-fitting pants and attaches to your leg with securement straps. Leg bags hold a smaller volume and should be emptied every 2 to 3 hours, or if it becomes too full. The second catheter bag is called an overnight bag and is used while sleeping. This allows more rest time between emptying your catheter bag. Overnight bags are a larger drainage bag and should be emptied every 8 to 12 hours. In this section, we'll provide you with step-by-step details on the following items: draining your catheter bag, cleaning your catheter bag, switching from a leg bag to an overnight bag, and switching from an overnight bag to a leg bag. Let's begin with step-by-step instructions on how to drain your catheter bag. Before we get started, you will need a sink with soap to wash your hands, a measuring container, and a toilet to dispose of urine. To drain the leg bag, follow these steps. Wash your hands with soap and water. Remove the cap and open the clamp. Do not touch the drain port with your fingers or allow it to touch the urine measuring container or toilet seat. If you were instructed to measure your urine, drain it into a measuring container so you can record the amount. You should also note the color and consistency of urine. To assist with the color, you may use the hematuria scale given to you at discharge. If you do not need to measure the urine, simply drain the urine into the toilet. After the urine is drained completely, close the clamp and replace the cap. Wash your hands with soap and water. To drain the overnight bag, follow these steps. Wash your hands with soap and water. Release the tubing from the plastic holder by squeezing the clips. Do not touch the tip. Open the metal slide clamp and let the urine drain into the toilet or measuring container. Do not let the tube touch the toilet or container. Close the metal slide clamp and reinsert the tube into the plastic holder. Wash your hands with soap and water. It's important to clean both your leg bag and overnight bag when they're not in use. This helps to reduce your risk of infection. Before you get started, you'll need the following items to clean your catheter bags: water, white distilled vinegar, a large container with a lid. An example would be a quart glass mason jar, large syringe. The hospital will provide you with your initial syringe, and alcohol swabs. Using your large container with a lid, mix equal amounts of vinegar and water. 1/2 vinegar, 1/2 water. Do not use yellow vinegar. You will need a total of 1 cup of solution to clean both bags. Using the large syringe, draw up the vinegar solution. Use an alcohol swab to wipe the bag's connection port and remove the cap. Gently push the solution into the bag through the attachment port. Repeat with a second syringe filled with solution. Clean the connection port with an alcohol wipe and recap the port. Swish the solution around and then empty. The technique keeps the bags clean and reduces odor. Do not rinse the bag with water after using the vinegar solution. Let the bags air dry. You may use both types of drainage bags for up to 1 month. After 1 month, you'll need new bags. You can purchase new bags at home health supply stores or ask at your doctor's office.
How often should you clean your overnight catheter bags? A. Once per week. B. Once per day. C. Twice per week. D. Twice per day. The answer is B. Once per day.
To change your catheter from a leg bag to an overnight bag, use the following steps. Wash your hands with soap and water. Drain the leg bag. Clean the connection between the catheter and leg bag with an alcohol wipe. Disconnect the leg bag. Clean its connection port with an alcohol wipe. Replace the cap and set aside. Remove the cap from the end of the overnight bag and clean the end with an alcohol wipe. Connect the overnight bag to your catheter. Clean the leg bag. Decide which side of the bed you'll hang your bag from. Tape or use a securement device to secure the catheter tubing to the thigh nearest the overnight bag. Hang the overnight bag lower than your body at all times. Arrange the tubing so it doesn't kink or loop. To change your catheter from an overnight bag to a leg bag, use the following steps. When you're ready to reconnect the leg bag in the morning, empty the overnight bag, fasten the leg bag with the elastic bands, clean the connection between the catheter and drainage bag with an alcohol wipe. Disconnect the overnight drainage bag, clean its connection port with an alcohol wipe, replace the cap, and set aside. Remove the cap from the end of the leg bag and clean the end with an alcohol wipe. Connect the leg bag to your catheter and make sure there are no kinks in the catheter tubing. Both catheter bags should be used with a securement device. A securement device is a device that is applied to your leg to reduce tension on the bladder and keep the catheter from being unnecessarily pulled on. It's important to ensure the securement device is in the proper location and allows the catheter to drain without obstruction. If a securement device is not available, you may use tape to secure the catheter properly to your leg. The catheter bag should always be positioned below your bladder. This allows for gravity to assist with urine drainage. If you feel like you have a full bladder, you should check to make sure there are no kinks or loops in your catheter tubing. If the catheter is above the bladder or is kinked or looped, it can cause urine to flow back into the bladder. A full bladder can place more pressure on the incision site, increasing your chance of discomfort. In addition, if urine backs up into the bladder, it can increase your risk of infection. Never remove the catheter unless specifically directed by your healthcare provider.
Where should the catheter bag be positioned at all times? A. Above the bladder. B. Even with the bladder. C. Below the bladder. D. Above your heart. The answer is C. Below the bladder.
It's important to keep the area around your catheter clean to prevent irritation and infection. Cleanse the area around the tip of the catheter and rectal area at least twice daily and after bowel movements. This is usually completed in the morning and evening. Clean using a washcloth, soap, and water. For males, if you are not circumcised, be sure to retract the foreskin to cleanse. Reduce the foreskin when finished cleansing. Triple antibiotic ointment may be applied to the tip of the penis to lessen irritation at the insertion site after cleansing is completed. It's common to have some bruising and swelling of your scrotum and penile area following surgery. It's normal and should go away after the catheter is removed. In order to reduce swelling, place a rolled up towel underneath your scrotum whenever you are sitting or laying down. Another recommended way to reduce swelling is to wear supportive briefs following surgery.
How do I deal with penile irritation? A. Cleanse around the catheter insertion site with rubbing alcohol. B. Cleanse area around the catheter insertion site with soap and water and apply triple antibiotic ointment. C. Cleanse around the catheter insertion site with vinegar and water. D. Cleanse around the catheter insertion site with water and apply baby powder to affected area. The answer is B. Cleanse area around the catheter insertion site with soap and water and apply triple antibiotic ointment.
Bladder spasms are contractions of your bladder. They're very common while a catheter is in place and can often be instigated by a bowel movement. Signs of bladder spasms include pain in the tip of your penis, urinary or bloody discharge around the catheter insertion site, and pain in your lower abdomen or pelvic area. To minimize bladder spasms, avoid constipation and reduce sudden movement that may pull on the catheter. We can also use medication management to decrease spasms. It's common to have leaking around your catheter, especially when you're experiencing bladder spasms. To help manage these symptoms, you can use incontinence products and monitor the draining of your catheter. If the catheter is not draining well, lie down flat and drink a lot of water.
Bladder spasms are very painful. What can I do to help? A. Take a stool softener. B. Reduce sudden movements. C. Take pain medications. D. All of the above. The answer is D. All of the above.
Pelvic muscle exercises are exercises that strengthen the muscles that control the flow of urine and bowel movements. These exercises are also known as Kegel exercises. They can help keep you from leaking urine, gas, or bowel movements if leaks are a problem for you. Both men and women can learn to do Kegel exercises by stopping and starting the flow of urine. After you learn which muscles to tighten, you can do the exercises in any position, sitting in a chair or lying down. You do not need to do them while you're in the bathroom. Do the exercises at least 6 times a day. Each time, flex your muscles 8 to 12 times and hold them tight for 6 to 8 seconds each time you tighten. Keep up this routine for at least 1 year. You'll probably notice results, but it might take a little time. Kegel exercises can be very helpful to your recovery. They help reduce urine leaks in people who have stress incontinence, which means they leak urine when they cough, laugh, sneeze, or strain. Control sudden urges to urinate that happen to people with urgency incontinence.
I am having urine leaking after the catheter was removed. What could I do to decrease the chance of leaking? A. Do jumping jacks 5 times per day. B. Walk long distances. C. Sit in a chair for long periods of time. D. Do pelvic muscle exercises, also known as Kegel exercises, 6 times per day. The answer is D. Do pelvic muscle exercises, also known as Kegel exercises, 6 times per day.
If you have any additional questions, please contact Adult and Pediatric Urology Clinic at 320 259 1411.